Hello student, in this video we will talk about the drug used in treatment of rheumatoid arthritis or anti-rheumatoid drug. So first of all, what is rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disease which is chronic, progressive and inflammatory in nature, which mainly affect the joints and the periarticular tissue. So in this joint inflammation occur, then there is synovial fluid proliferations and synovial cell proliferation and destruction of the articular cartilage. So what happen in this disease is, first the immune complex of IgM will activate the complement system, which will release the cytokines like tumor necrosis factor alpha and interleukin 1, which causes the chemotactic of neutrophils, which leads to the synovial proliferations and initiate the inflammatory process, which causes the edema. Then the inflammatory cells will release some lysosomal enzymes. These lysosomal enzymes will damage the cartilage and erode the bone. Next, there is also a secretion of prostaglandin in this condition. So prostaglandin will be responsible for the vasodilation and pain in this disease. The rheumatoid arthritis disease, there is always remission and exacerbation of the symptoms. So what is the goal of the drug therapy? The goal of drug therapy is we have to ameliorate the pain, swelling and joint stiffness. Means we have to relieve the pain of the patient. Then we have to prevent the destruction of the articular cartilage and bone erosion. Next is we have to preserve the joint function and in turn prevent the deformity of the bones. So there are two aspects of this therapy. First, we have to relieve the pain, and second, we have to inhibit the progression of the disease which leads to the deformity. So the drugs which are used for the treatment of rheumatoid arthritis are mainly NSAIDs, that is non-steroidal anti-inflammatory drugs, then glucocorticoids and disease modifying anti-rheumatoid drugs, also known as DMARDs or SAARDs, because these drugs works after 3 to 6 weeks, means their action comes after 3 to 6 weeks of the treatment. So they are also known as slow acting anti-rheumatoid drugs. So we will discuss these drugs one by one. So we have discussed that there are two aspects. First, we have to relieve the pain of this disease, and second, we have to stop the progression of the disease. So for relief pain, we mainly use the drugs NSAIDs and glucocorticoids, and to stop the progression of the disease, we use DMARDs. So NSAIDs are non-steroidal anti-inflammatory drugs. NSAID will inhibit the enzymes cyclooxygenase, which will inhibit the release of the prostaglandin, and prostaglandin is responsible for the pain in joints and causing the stiffness. So NSAIDs will provide the rapid relief pain. They also decreases the inflammation and they decreases the swelling and stiffness, but they do not stop the disease progression. So the mainly drug used in NSAIDs are like aspirin, ibuprofen, diclofenac, naproxen and piroxicam. These drugs are commonly used, but long-term use of these drugs are related to the significant toxicity, so they are not used for a longer duration. Next is glucocorticoid. As we studied in glucocorticoid, that glucocorticoid inhibit the enzyme phospholipase A2, so there will be no formation of the arachidonic acid, and so the formation of the prostaglandin and leukotrienes and cytokines will be inhibited. So glucocorticoid will inhibit the leukocyte migration. Next, they also increase the lysosomal stability, so there will be no damage to the cartilage and erosion of the bone. Next, glucocorticoids are strong immunosuppressants, and they inhibit the production of the prostaglandin and leukotrienes and also interleukins production. So glucocorticoid, mainly prednisolone, hydrocortisone are used, but also their long term use have severe adverse effects, so these are used for a shorter duration and to relieve the acute attack of the pain in rheumatoid arthritis patient when there is exacerbation of the symptoms. So next aspect is we have to stop the disease progression. So for this, the drug used are known as disease modifying anti-rheumatoid drugs, DMARDs and SARDs, slow acting anti-rheumatoid drugs. So these drugs are divided into like biological agents and non-biological agents. So DMARDs although these are very effective drugs, but these drugs are mainly reserved for patients with progressive disease who do not obtain satisfactory relief from the NSAIDs. They are capable of arresting the progress of the disease and also induce remission in these patients. So DMARDs are divided into like non-biological drugs and biological drugs. Non-biological drugs include immunosuppressant and other immunomodulator, and biological drugs include TN alpha inhibitors and other biologicals. So first we will discuss about the immunosuppressant. Immunosuppressant drug include methotrexate, azathioprine, cyclosporine, etc. So first we will discuss about methotrexate. Methotrexate is a dihydrofolate reductase inhibitor. Means it inhibits the DHFR enzyme which is responsible for the formation of the folic acids. So as folic acid. So what happens is it inhibits the DHFR which influence the macrophage and lymphocyte function. Next, the other mechanism of action of methotrexate is like they increase the adenosine level, and which is a potent inhibitor of the inflammation. Next, methotrexate also inhibits the cytokine production, chemotaxis, and cell mediated immune reaction. So this is an effective drug in the treatment of rheumatoid arthritis. But although these are reserved drugs, but methotrexate is now becoming a first choice and standard treatment for the patient who are not responding to the NSAIDs and glucocorticoids. Methotrexate is started with low dose, that is 7.5 to 15 milligram, and then the dose is increased. Although the effect of this drug may take 6 weeks to 6 months to become evident. So these are also known as SARDs, that is slow acting anti-rheumatic drugs. Methotrexate is contraindicated in pregnancy, in breastfeeding, and in liver diseases, as methotrexate, long-term use of methotrexate will cause the hepatic enzymes increase. Also, they are not contraindicated in active infection and in leukopenia and peptic ulcer. The adverse effects caused by methotrexate are like nausea, vomiting, mucosal ulcers, and they also cause the dose-dependent hepatotoxicity. To counteract or to counterpart them, to inhibit the toxicity of the methotrexate, leucovorin is administered with methotrexate to decrease its toxicity. Next drug is azathioprine. It is a purine analog and it is a potent suppressant of the cell-mediated immunity, and it also inhibits the T and B cell function, because as we know that rheumatoid arthritis is a autoimmune disorder. Other immunosuppressant drugs like gold and D-penicillamine are used in past times, but these are not used because they have a huge toxicity on the human organism, and there are better substitutes are present for the treatment of rheumatoid arthritis. Next drugs are like other immunomodulator, which include sulfasalazine. Sulfasalazine, what happened to the sulfasalazine? When sulfasalazine is taken, it is splitted in gut by colonic bacteria into sulfapyridine and 5-aminosalicylic acid. 5-aminosalicylic acid, this metabolite is effective in the treatment of ulcerative colitis. But for treatment of rheumatoid arthritis, the metabolite of sulfasalazine, sulfapyridine, is responsible. It inhibits the production of superoxide and inflammatory cytokines, which exerts the beneficial effect in rheumatoid arthritis. So next drug is hydroxychloroquine and chloroquine. These two drugs are anti-malarial drugs. They reduce the monocyte interleukin 1 and they also inhibit the B lymphocytes. They also increase the lysosomal stabilization, so these are effective in the treatment of rheumatoid arthritis. Long-term use of these drugs causes retinal damage. Next immunomodulator is leflunomide. It inhibits the dihydroorotate dehydrogenase. It inhibits the production of the antibodies, and T cell proliferation is also inhibited. Toxicity caused by leflunomide is diarrhea, alopecia, liver toxicity, leukopenia, and skin rash. This drug is also contraindicated in children, in pregnant women, and in lactating women. So these were about the non-biological drugs. Now we will discuss about the biological drugs. Biological drugs include TNF alpha inhibitor and other biological. As we know that TNF alpha, that is tumor necrosis factor alpha, is also a main inflammatory mediator. So we have to inhibit this. So for this drug, to inhibit these is drugs are etanercept, infliximab and adalimumab. These inhibit this TNF alpha, and so there will be they will inhibit the production of the inflammatory mediators. Etanercept is a recombinant fusion protein, while infliximab is a chimeral monoclonal body. Adalimumab is a recombinant human monoclonal antibodies. They prevent the TNF alpha activation. They causes toxicity like pain, redness, itching, swelling at injection site because they are given in a parenteral injectable. And other biological includes like anakinra, abatacept, and rituximab. As we know, that interleukin is also inflammatory mediator released during the disease progression. So the anakinra will inhibit the interleukin 1 receptor, and it is a receptor antagonist. It is used rarely because it has adverse effect like local reaction and chest infection. It is given by subcutaneous route. Next drug is abatacept. Abatacept inhibit the T cell activation, so it acts as an immunosuppressant. This drug is used in the treatment of moderate to severe rheumatoid arthritis, and it can be given either by intravenous route or subcutaneous route. Next drug used as a biological agent for the treatment of rheumatoid arthritis is rituximab. It is a monoclonal antibody and it depletes the B lymphocytes. This drug is reserved for the cases who are methotrexate resistant. So mainly the drug used for the treatment of rheumatoid arthritis are NSAIDs, glucocorticoids, and the non-biological agents like immunosuppressant are mainly used. These these biological agents are used only for reserved cases and when there is a moderate to severe rheumatoid arthritis. So the mainly drug which are used for the treatment of rheumatoid arthritis are either NSAIDs, glucocorticoids, and immunosuppressant drugs. So this is about the treatment of rheumatoid arthritis. If you like the video, please share, subscribe. Thank you.